Good afternoon, very lovely people in a very lovely state. This is my home state, so it's very lovely for me, and a very beautiful surroundings. Namaskar to all of you. It's an honor to be here, primarily because it's my home state. I've never worked here as a professional, and I work in a field which has this state has maximum problem in that. So that's very ironical that I'm not being able to work here. But I'm trying my level best. I've been trying for 3 years. I hope by another, say, when all my hair have grayed, I would have succeeded. So I'm just praying, and I hope the community joins me soon, very soon. You know, there are cliches. World is full of cliches. Women empowerment, women's health, child development, giving back to community. You know, all these are very beautiful cliches. Like, you know, you have Miss Universe saying, I want to work for world peace. I have not seen a single Miss Universe coming up to work, work for a world peace so far. So what we are trying to do over here is, I'm a medical doctor. And specifically a medical doctor who doesn't even see a patient. And I only see slides, I only see specimens, I only see blood and tubes. I don't see patients at all. For past 20 years, I've been doing this. For past 3 years, my focus changed to women empowerment primarily because my focus changed to something which is totally preventable. It's an irony that we let women die because something that takes 20 years to develop. In those 20 years, we do have a call of action. I have spoken about this, I think, zillion times to the technical community, the doctors community, to NGOs, but I've never spoken to, let's say, the people who can make a difference. The people who can make a difference is the community. I am saying I'm not giving back to the community. I'm asking community to come up and support this cause. Nobody can give you back. The community itself can give back lots to society. Stop expecting, start pitching in. So that is my call to action to all of you. Breaking taboos, you know. I'll focus on the first point, assets and not liabilities. I'll quote a very nice example. My brother, my mentor, my, whatever you can call him, guide, friend, philosopher, he's a father to me. He's raised me like a baby from when I was a child to now when I'm little, not so childlike, I'm a little grown up, I hope. But when he was of marriageable age, and he went for matchmaking, and the prospective bride's father interviewed him. And he says, okay, guy, what's your liabilities? He said, I don't have a liabilities. He said, no, but you have a sister who's unmarried. He just stood up and he said, sir, she is not my liability, she is my asset. So if you think she's my liability, I think I don't deserve to get married into your home, and vice versa, and I'm walking off. And he just romped off from that space, and he did not really marry the girl. It is regardless of how good she was. She says, anyone who considers my sister as a liability is a person I would not like to be associated with. I think that, and the family who raised me up, gave me lots of power to assert myself time and again through my journey of professionals, to talk to women about when I started working in communities for preventing cervical cancers, because people did not have time to screen. Communities did not know how to take samples. I mean, this is a little technical subject, but you have to take samples from the women's cervix to screen them for cervical cancers. And that is not a very highly technical part, but somebody needs to be aware of what exactly needs to be done. So I started training them. And while training them, I started interacting with the communities. I started going to various slums, various residential areas, and various other localities. I found that there were taboos. For past 68 years, we have not been able to break away taboos. We've been talking about women empowerment. Jawaharlal Nehru, our Prime Minister, the first Prime Minister, have been talking about women empowerment. But 68 years down the line, we are not so, handicapped that we cannot bring an idea into action. I really don't think so. We've gone into Mars. We've sent such a wonderful thing into Mars at the cost which is possibly less than an auto journey from, say, one point of India to another. So why can't we bring a simple idea like empowering women to the ground? I found that having screened almost 15,000 women across India, and that comes from Meghalaya to Srinagar to maybe Cochin, Gujarat, Maharashtra, various kind of women, various kind of environment, meeting lots of women from globally also, European, American, African, all kind of this thing. I saw that the taboos were people in India, we don't want to speak about our sexuality. We don't want to speak about when am I going to get married. In India, we don't have our right, you know, on deciding when do I have a child, when do I want to have a child. My mother-in-law, or not mine, I mean, she should not take offense. My mother-in-law will decide when do I want to have a child. Or some other neighbor will decide, Acha, you did not have a child till now, you've been married for 2 years. How many children do you have? You have only one daughter. Okay, when is the next going to be born? It's my choice. That's having children, how many children I have, I should know when do I want to have a child. But I'm not willing, or I'm not daring, and I do not want to talk about this because it's a taboo. We cannot talk about sexuality. We cannot talk about pleasures. We cannot talk about how important it is for a woman to handle her own health, how important her own health is. Regardless of whether a woman is from metro, she's from rural area, she's from educated society, she's a corporate woman, we do not talk about health at all. This diagram is very interesting. You can see the larger circle, which is the blue. Predominantly, it's blue. In India, I'll just give you an example. In India, it represents 340 million or maybe more. These are the women, total women we have. The green chart, the green circle, comprises of women who are supposed to be screened right from the day they turn 21 years of age. The yellow dot, and that the green dot comprises a huge lot of number. That if it's not 340 million, it must be 300 million or so. We do not have resources, manpower, money, whatever, to screen them. Then we have one smaller circle, which gives us the exact number. The green is the women who are at risk. The yellow is the number, actually the women who need some sort of follow-ups. The red is the number where you need a super specialist or a specialist intervention. So if we start engaging, the community on a green circle, we'll run out of resources. So we need to find something which can actually be implementable in communities, outreach. This is a very technical aspect of it, but the whole thing, the whole idea of talking about this whole thing is that we cannot spare even a single woman from screening. In Western world, if you have a woman who has developed a cancer, it's possibly because she has missed the screening. So we cannot really afford to miss all this. We have to include all of these in screening, but how do we do it? The community is not able to talk about it. We do not want to bear ourselves to examinations. We don't want to come up and talk about it. So my thought is, and we have amazing data. I mean, of all the whole jargon of data, we have that of 10 cervical cancer in Southeast Asia, 8 are from India. I mean, India is supposed to be one of the, quite a progressive nations. And we are contributing to 8 out of 10 in Southeast Asia. That's very surprising. And the next data, which comes from the whole lot of it, is just a comparison. In India, you have out of every 2 women diagnosed from cancer, 1 dies. So that is 50% mortality. Whereas if you see in very well-screened countries like United Kingdom, of 50 women diagnosed with early lesions of cervix or carcinoma in situ, that means the cancer which has not spread, 49 survive. Only 1 woman out of 50 die. So imagine the whole spectrum of it. We let half of our population die, and there we prevent those deaths. We value them. We do not value our women. Why we do not value our women? You can actually write, I'll say I can write a Harry Potter 7 series on why we do not value our women. That we have so much of a data in our system that we can actually write so many. But the nutshell is, if I have to just bring it on possibly one sentence, the nutshell is a woman who has cervical cancer is a woman who is past her reproductive age group, mainly let's say productive reproductive age group. She has given birth to children. Her children have grown up. Nobody needs her to, generate the next produce the next generation. Her next generation is being empowered. The son and the new daughter-in-law is empowered. She is not needed. If she is not needed, even if she dies, okay, fine, she died of cancer, so okay, doesn't matter. It's all right. I mean, she's not of any value to us. She's not really impacting the economy of anything. That's what I was told by somebody who was evaluating my project, that a woman does not really, 70,000 women dying every year does not really impact our economics at all. So imagine the cost of screening 340 million. We do not have that kind of money. So I've understood that if we have to empower women, it cannot come from policies. It cannot come from governments. Governments are trying very hard to do this. Governments are trying to get experts. Governments are really hard pressed to see solutions. But to bring on solution, it has to be a collaborative effort. And the most important collaborative effort for women empowerment really comes from a family. When woman is well aware of herself, that I'm an individual, I am valued, I need to take care of myself. Because as a child, I was valued by my family, my society, my colleagues, my friends, and all of them, they think that I'm pretty precious to be, handle everything, and I'm a person who can possibly contribute in a more wider sense. So how do we achieve this impossible goal? We have to have the Venn diagram, it's very nicely explained it. A women empowerment can only come when you have a family's involvement in this. And that itself will lead to your healthy women. Healthy women will have a healthy children. Healthy children will have a healthy nation, blah, blah. We all know about the whole, we can imagine the whole spectrum. But baseline is empower your women. Let your daughters, value your daughters, bring your daughters with very love in, and say that they are your assets, not your liabilities. That is something which I have got from my own family. That has given me guts to come up here, and despite being a medical doctor, talk to the, to the wide spectrum of people, to talk about something as technical as preventing cervical cancer and linking it to women empowerment, which really does not really connect if you see technically, but in the whole nutshell, it does connect somewhere. Because I have seen in my 3 years experience that unless and until the technical advances of Athena trials of USA, if it doesn't come to my village in Meghalaya or Kullu, it doesn't really matter to me. It has to come down. Otherwise, even for them, the science has not progressed beyond anything. We have a support system. I'll share a small, I keep meeting lots of women. And while we do screening, I normally, it's a whole melee of people over here. We have women coming up. We have, we have laughters because it's quite an intimate kind of examination. And when we have a community getting screened, then there are some shy people. Then you have to break that shyness. Then you have some women who really, they're very vocal about, I don't want to get it tested. So we employ the local tactic. We employ the communication skill. We employ the women for women. So they become the advocate for the screening. So first we get the shyest women and the most vocal women to the examining table, get them screened and tell them, is it okay? They said, yes, this is fine. I said, now go and tell others and bring more to me. So co-sisters of a family. The elder co-sister came to me for a screening. I screened her. She says, yes, let me call my younger co-sister. She should also get screened. So this is the power of sisterhood. Now the next slide. This is again a power of sisterhood. Till today morning, for 3 months, I knew that I have to speak on this topic. Dr. Thakur is there, she's my roommate, and I was kind of worrying, what should I speak? I can speak a lot. I can speak like anything, but I don't know what to tell to the community which does not understand the technical jargon. I do not have the communication skills, to deal with the community. I can talk to doctors, I can talk to volunteers for my cancer screening, but I cannot talk to the community the way they can understand me. So she is a communication expert. She helped me make this project. And I was so happy, and at the end of the day, I said, yes. Now I can see that I can talk. I really don't know. You won't understand HPV DNA. You won't understand biomarkers. You won't understand anything at all which I'm going to speak. But I want to be heard. I want to be heard because every one single cervical cancer hurts me. And I want to be heard because every single woman who's denied her rights hurts me. And every woman, right from the day she is born, she is precious, she can come up, she can contribute to the society. Then you don't have to give back to the community. That community will give it back to her. That community will give back to society. The community of the women will give back to India. So if we have to really bring a change, we have to empower that soul which is lying caged inside, saying, don't do this, don't do that. I tell them, do everything. Open up, do whatever you want, no right and wrong, fall, get hurt, get up, move, but do everything. So they must do everything. That is my call to action. Support your family, support your daughter, have soul sisters, and collaborate together. Thank you so much.